Today, we're talking with my friend, Dr. Jay Bhattacharya. Dr. Jay Bhattacharya is a physician. He's also was on faculty in medicine at Stanford University. He's an epidemiologist and a healthcare economist, and he's the newly appointed director of the National Institute for Health Research in the United States. So warm welcome, Jay.
Thank you for having me on, David. It's a delight to be able to come back and talk with you.
Well, Jay, it's been a number of years since we've known each other, and it's been quite a journey. And I guess I want to start off by just congratulating you on your appointment as the director of the NIH. What were you surprised by the offer to join the administration?
Well, in one sense, yes. This is not a job I ever sought or went after. I was perfectly happy being a professor at Stanford University until 2020. I guess I was perfectly happy. And the 4 years of the pandemic were a little bit crazy. But when President Trump won, I had been working in the summer before to think through how I might reform the public health institutions of the United States. I wrote a white paper, circulated to some people, I wrote it with some friends, and we and somehow got in the hands of Bobby Kennedy, who then had his folks reach out to me. I was, I guess I'd been preparing for it, but also never expecting it. So it's such a great honor. The National Institute of Health, as troubled as it was, I think during the pandemic, is still an amazing institution. It's still the single biggest public funding agency for biomedical research in the world, and has had it's a history of so many great accomplishments. So the ability the honor to be able to lead it is amazing, especially at this time when so many people have lost trust in science and public health.
Well, congratulations. And I know that you care deeply about that very mandate of renewing trust in public health, to be able to renew institutions, great ones such as the NIH. So just tell us briefly, what do you see as your mandate at this juncture?
Well, I think there's the problems caused by the pandemic, a breach of trust that's led, I think it's the 1 in 4 Americans in 2024, late 2024, told the Pew the Pew folks that they do not trust that the scientists do the work the scientists do. They have the well-being of the American people at heart. We have to fix that. 1 in 4 think that scientists are working against the regular people. I mean, that's not sustainable, especially since most of the work scientists do in biomedicine is to help heal people, to cure people, to treat disease. And so I think that and at the same time, there are very real reasons why so many people feel this way. I mean, David, you and I know what happened during the pandemic. The assertions that we had to mask toddlers had happened in the United States. Schools closed; their kids still suffering years behind in schooling as a result. Churches closed. There were assertions about the COVID vaccine that turned out not to be true, about whether if you get it, you can stop you from spreading the disease. There were mandates in Canada. You couldn't even, in some provinces, you couldn't leave the house if you were unvaccinated. Almost
unbelievable.
Right? You couldn't travel in public travel. And so you can understand why a lot of people lost trust. At the same time, it's still important that science really does produce advances that that have the capacity to really make people better and make their lives better. So I need to bridge that divide. That's really my mandate.
Exactly. Well, it's a very exciting and critical mandate more than ever. And I think part of your mandate, is illustrated by your own personal story. I mean, you were one of the co-authors of the Great Barrington Declaration with Dr. Martin Kulldorff, and had the pleasure of just talking with him yesterday. And of course, Dr. Sunita Gupta from Oxford. And it is remarkable that you basically asserted in the Great Barrington Declaration at the time, going back to 2021, basic best practices of public health, in which you were attacked. I mean, this is, I think, part of the paradox is that you had all kinds of parties viciously go after you personally in so many ways, after things that were just basically common sense, things like asserting natural immunity.
Yes, it was. I think it was October 2020. So, and
2020, I
you're
stand
also,
corrected.
but you're absolutely right, David, that it was just common sense. So the idea of the Great Barrington Declaration was the risk of COVID in 2020, and even now, was so much greater for old people than for young people.
Hmm.
So the Great Barrington Declaration said, protect old people better, and for young people, let them live their lives. Let them go to school. Let them play with their
Yeah.
friends. Let them like do what young people do. And that to me, that wasn't such a as a someone who's been working in infectious disease epidemiology and in health policy for a long time, that didn't strike me as like particularly novel. That's how we dealt with all other pandemics, all respiratory virus pandemics. But it came across as shocking in the context of October 2020,
Hmm.
and the various parts of public health that dominated public health at the time, the leaders of public health, abused their power to suppress any conversation about it. Like I
Hmm.
remember it being discussed by the CBC in October 2020, accusing
Yes,
me of
right.
being a fringe figure,
Yeah.
that I wanted to like let the virus rip and kill people. It literally
Hmm.
said to help protect the lives of older people
Hmm.
better. That was the key plank of it. So the whole thing was just heartbreaking. And I think public health authorities who were in charge then, they really did abuse their power and bear considerable responsibility for the situation we're currently in.
I really agree. And so, if you look back at the story of COVID-19, are there obvious lessons that come out of that beyond, well, the need for healthy discussion, to have debate that focuses on what is the best scientific decision here that serves people rather than just politicizing it?
Absolutely. In fact, that's my central lesson. You absolutely nailed it right on the head. And it's the idea that you can have science without free speech is ridiculous. Like
Hmm.
the whole Enlightenment involved essentially dethroning authority from the power to say what's true and false in science.
Hmm.
Science emerges out of discussion and debate and logic, data, all that. It comes out of contention, people talking to each other,
Hmm.
basically. And if we'd had that debate, that governments, if that the governments hadn't, like Canada, the United States, a whole bunch of Europe, if the governments
Hmm.
hadn't worked to suppress that debate from happening, put their fingers on the scale, a lot of what went wrong might have been avoided. We might have had much better results. I mean, it was really hard to tell people, for instance, about what was happening in Sweden during
Hmm.
the pandemic. Sweden, of course, never locked down, never closed schools for kids under 16, and yet they had vastly better outcomes for everybody. The lowest all-cause excess deaths in the world. They protected human life better than Canada, protected human life certainly way better than the United States, without lockdowns. And that
Okay,
we
so
couldn't
that's
discuss
pretty
it.
clear in your mind that Sweden did it right, and well, we could actually learn from that example.
It's incontrovertible, right? So if you look at the excess mortality, Canada still has high excess mortality relative to Sweden. Sweden
Hmm.
has actually, since 2020, Sweden has negative excess mortality. Negative.
Remarkable.
They
Yeah.
reduced mortality rates during the pandemic, whereas Canada and the United States, but we have higher mortality, positive excess mortality relative to what you would have expected based on
Hmm.
baseline from 2015 to 2019 or something.
Hmm.
It's I mean, it's not debatable. The
Hmm.
Swedish kids, they suffered no learning loss. My kids were out of school for 2 years in California. The harms from the lockdown we're still seeing to this day: high levels of suicidality, high rates of overdoses, depression. A lot of
Hmm.
the sort of the hangovers from the lockdowns, a lot of the economic fights that we've been having the last couple of years are lingering effects of all the inflation. Well, what do you think? How do if you print trillions of dollars, what to pay for
Hmm.
locking the world down? What do you think is going to happen? Yeah, I think a lot of the harms could have been avoided had we followed the Swedish strategy.
Well, it's truly a remarkable case study, and so if we can just deal with a key question here, it would be, why does this matter? Like, if we look at COVID-19, often in conversation with Canadians, they're either in disbelief because they listen to a lot of legacy media like our state broadcaster, the CBC, And you don't hear any of this. I mean, it's very discouraging, the lack of information regarding these basic facts now, I think, that lead us to believe that we could have done a much better job, to put it mildly, managing COVID-19. And there's people who just kind of want to move on. This is a really bad memory. So why is this so important as we look to the future and right now when we look at healthcare policy?
Well, so first, the obvious point with that this won't be the last pandemic, right? And lockdowns in many countries, and I'm sorry to say, David, in Canada, are now the default strategy. If you expect to be able to send your kids to school for their entire childhood, well, if there's another pandemic, you know, it's very likely that we will have the same policy in place in Canada and elsewhere. In the United States, the advantage of having President Trump and now Secretary Kennedy in office is that we can start to change the pandemic plans and start to change the conversation. In so many other countries, like in Canada, doctors lost their practice license just for literally for opposing lockdowns on the web,
Unbelievable.
on Twitter. You have now a situation where in Canada, a control of the media environment that is directly opposed to telling the honest truth about the data of what about the efficacy of the Canadian COVID response, and a suppression of all of the dissident voices in ways that have made it very difficult for people to speak up. I mean, you're incredibly brave for just having me on a podcast. That's been true for years, David. I quite admired that.
Well, thank you.
So like there's a risk of the thing repeating again. Second, it's a missed opportunity. Like you really have a chance now to address some of the fundamental problems in science that led to the bad outcomes. Like why was it that that the scientists landed on things that turned out to be false? Right, like, and then gave advice, essentially a kind of hubris in science about knowledge that they didn't actually have. We can use the opportunity to reform science so that it actually works better for the people of the world. And I think that's the second thing. And third, I think it revealed problems in our governance structures. Right, the rights that we thought were inviolable. The right to speech, the right to assembly, the right to even visit your loved ones in a hospital when they're dying, the right to gather with your family in Thanksgiving, the right against being discriminated against based on your medical decisions, the right, all these like basic fundamental rights that we thought we had, turns out they're disposable. And so, again, it's an opportunity to reform our government structures so that those rights that we always thought of as inviolable actually become inviolable in practice.
Right on. So you're really making eloquently again the case that without freedom of speech, without vigorous debate, you can't have, frankly, science, nor can you have really ultimately public health.
That's absolutely accurate. That's absolutely accurate. Because, David, I mean, I do believe I was right about the Great Barrington Declaration. I don't want to downplay that. But as you said, it was like obvious. It was clear. Like it wasn't. It was just common sense, right? So it's not surprising that turned out to be right. But there are lots of things. I'm a scientist, and it's very, very often that I will have a scientific idea that turns out to be wrong. I'll have a hypothesis. I'll go read the literature, or I'll do some experiment, and it turns out I'm wrong. That's normal in science.
Indeed.
And you know what? My friends are the ones who tell me I'm wrong vigorously. It's just great fun to have them it's fun for them for a little while. But then I learn. But that's how science works, is by these kinds of conversations that people have with each other where they share different ideas. Science advances if we have an environment where that kind of vigorous contention, where data and experiment and logic guide who wins, replication of scientific ideas guides who wins in the argument. And you know what? We all win because, the best way, David, the easiest way to be right all the time. As soon as you're wrong, just change your mind. I mean, that's simple.
Exactly. No, right, well said. I mean, and part of this context that I find kind of frustrating, quite frankly, is that you think we would come together now in light of everything that's happened with COVID-19 and say, yes, amen to more discussion and vigorous debate. And yet it's a mixed bag. You have a lot of people that say either we can't talk about this because no, there's a consensus, or we just follow the science and you're a bunch of kooks. So it devolves into ridiculous name calling instead of a kind of I believe, a sincere objective of saying, how do we have a real discussion so we can serve the people? Are you frustrated by that dynamic? Like I just listened to some of the hearings this morning at the U.S. Senate with Secretary Kennedy, and I was shocked. I mean, there were so many persons. They weren't asking questions. They didn't even allow him to even give a response. I mean, it devolved into absurdity. Is that what we're getting into? Is just that hyper politicization that we can't even have a conversation?
I mean, it's been that way for several years, and it's been quite frustrating during the pandemic because the whole strategy of so much of public health was to silence anyone who criticized them, and you saw that play out in the hearing that Secretary Kennedy did in front of the U.S. Senate. I think the thing, just psychologically, imagine that you thought that you needed to spray down your groceries, that you needed to mask in front of when you walked around at home, or you needed to shun your family, your unvaccinated family, that it was okay to take away the rights of people to gather, to worship, to send their kids to school, and so on. Suppose you thought all that was really necessary, right? That's a great sacrifice that public health asked the public to do. And many members of the public did those things because they thought they were doing good. It's very difficult in retrospect to be told that those sacrifices were not really that worthwhile. And in fact, maybe one of those sacrifices may have caused harm. I mean, that's essentially the problem that Bobby Kennedy has, I think, and part of the problem that I have is that in order to have a conversation, we have to be honest about what went right and what went wrong with ourselves. And, it's very hard to tell yourself when you take a decision or an action that's of some considerable consequence that in retrospect it went wrong.
Yeah, no, I think you're right. So there's it's a pretty humbling process to be able to look at this. And it's interesting are there many examples in your mind where there's been a kind of a reckoning to the decisions that were made? And I think of, for example, in Denmark, where there were elements within the government, and you'd be familiar with this as well, within the media as well, that said, you know what, we goofed. We actually didn't do our job. And in this case, I believe leading members of the media said that we really didn't speak truth to power. We didn't look at the issue from a critical point of view and do our homework. Are you seeing examples of that around the world? I mean, you've got a unique perspective. Are you seeing any kind of reconciliation, to use that word?
I mean, the Danes are a great example. They closed schools in spring of 2020, and then when the Swedish data came in, the Swedes found that not closing schools had not harmed the population regarding COVID. The Danes apologized. The Danish public health apologized. It was amazing. But I've seen some rays of hope. So, like, for instance, there's a couple of friends of mine who were professors on the left at Princeton University, a very prominent university in the United States. And they wrote a book, I think the title is In COVID's Wake, which is an honest evaluation of the evidence on lockdowns. Written from the point of view of the left. Another friend, David Zweig, who was a New York Times author, wrote a book about the harms of school closures. Another book by again from the left, Joe Nocera, has written a book about COVID. I mean, you're starting to see because if you think about it, it wasn't really a right-left thing. I mean, a lot of the the provinces in Canada that were nominally led not by nominally right-wing or politicians that are on the right, like that they're part of the Conservative Party that locked down. Right, so it was pretty much a universal thing, but I think the right has moved away from lockdowns as a whole, especially in the United States. I think the right has said those were a tremendous mistake, a violation of our basic fundamental principles. The left has been a little more reluctant, and I'm starting to see even in the United States some rays of hope, where
Oh,
Honest
good.
people are saying, because it's not fundamentally a political thing. The fact I'm talking about right
Indeed.
and left pains me. It's really it's a scientific question. Was lockdown the right strategy in terms of disease control? Was lockdown the right strategy in terms of protection of human life? What were the harms of lockdown? What's the evidence regarding the benefits of lockdown in terms of disease spread? And it turns out the scientific evidence is pretty clear. It didn't protect human life from COVID or from other risks, and it had all these negative side effects. That's just what the data show. It doesn't matter if you're left or right. That's just the reality.
Indeed. So, do you see any glimmers of hope that there are jurisdictions actually trying to do some type of, I hesitate to use the word inquiry, but thoughtful reflection? I mean, any high functioning family organization, let alone nation, will reflect on what's happened and say, what do we learn from this? Are you
I mean, I
seeing
don't know if
any?
you've been tracking the UK COVID inquiry.
Indeed.
It's been mixed, to say the least. It's been expensive and very, very mixed. They sort of, in many ways, have avoided the key questions and avoided the key data. But on the other hand, I don't know. It may take a little while, but we're starting to see some open. Like for instance, President Trump had this fantastic tweet the other day, or I guess it's on Truth Social, where he said,
Yes.
"Look, I was told that that the Pfizer vaccine by lots and lots of folks from Pfizer and elsewhere showing me great data. Let's open this thing up to debate and discussion, and let's see the data so the whole public can see what I'm seeing." And
Exactly.
let's have an honest conversation. I mean, that is a man who wants to understand what happened, wants to see the truth, and is willing to revisit old decisions without fear of of like being second guessed. Because what he cares about is the truth rather than protection of legacy or protection of your self image as like having been right during a difficult time.
You know, I did notice that posting by President Trump on Truth Social as well. And what impressed me about that question was that it's a kind of a commonsensical question, as you say, that are on people's minds. Like anyone who has been alive through this pandemic would have those questions. So let's answer them together in a sensible, honorable way. What's so difficult about that, Jay?
David, I will go from your lips to God's ears. Let's let that happen. It's for sure no one got everything right. It's a tough, difficult thing when you're in the
It
middle of
is.
a pandemic and stressful things are happening. So, but like let the data decide. Really, what we need is to learn these. You've been asking me about this through this whole interview, and I think I laud you for that. The key thing is let's learn the lessons so that we can undertake the necessary reforms, change our systems, found out where they're weak. Let's make them stronger. Let's come together as a world to try to figure out those lessons so that we don't make the same mistakes again.
Right on. So as we look to, well, rebuild trust in health institutions and kind of renew science, and as you've alluded to earlier, how do we go about that? Is it basic principles of, well, transparency and ensuring that people are autonomous? Like how do we go about this, Jay?
Well, I think there's actually two distinct aspects, right? So the question is, how do we reform science? So, so there's lots of problems actually science had. There were like replication crises. There were like issues with, rigor, and a whole bunch of problems that science had that predated the pandemic. Even discussions of like freedom of being able to say what you think in science were like that was again to some extent predate, although it got much worse during the pandemic. Then there's the question of what's the proper role of science in social decision making, right? So science might say that closing schools has X% effect on the probability of getting COVID in some period of time, right? I think that X is basically zero, but let's say you think it's positive. But then there's the question of should we close schools? Well, that's not a scientific question only. Science enters that question, but there are other values that play here, right? There's other scientific questions. What's the impact of schools on kids' mental health and well-being? What impact does closing schools have on their long-term health outcomes, on their long-term prospects in life? What affects the school? How important is education relative to other values that people may have? Like if you raise the probability of dying by X very, very small percent, is it worth it if you get much better education outcomes? Like, where's the trade-off there? Maybe there isn't one. Maybe society decides that it's worth anything to avoid that X percent. But that's not strictly scientific. That's a values question that's distinct from science. So you have two things. One is the reform of science itself, and then the clearer delineation between in social policy between the scientific inputs and the social values that lead to policy decision making.
Wow, that makes a lot of sense to me. And I guess when the rubber hits the road here, how are you finding it to undertake that kind of mandate, to show that kind of transparency?
I mean, it's I was a professor for a long time, David. So it's been challenging, to say the least, to come to Washington D.C. But you know what I found is a lot of people of goodwill who want this reform. I mean, it's kind of it's amazing that I got picked after being sort of a dissident to be the leader of this institution. But that President Trump picked me to be the leader of this institution after being a dissident. But I think. I don't want to use the opportunity just to like sit back and say, okay, it's fun to be the head of the NIH. The key thing is to use the opportunity to do reform, to have the hard conversations, and to have science work for the benefit of the people. We need those reforms. We need to learn those lessons. That's what I've been trying to. That spirit of gold standard science that President Trump always talks about, that Bobby Kennedy always talks about. I've been trying to bring to the NIH.
Well, that's a tremendous vision. So help us a little bit with some further questions here. There's been a lot of skepticism in retrospect regarding the vaccines and the whole announcement to kind of do a reset on research funding of the mRNA vaccines. Help us understand that announcement and the significance of it.
So actually, just to for clear, the announcement by Secretary Kennedy a few weeks back was to cut production contracts for mRNA vaccines for respiratory diseases. We're still doing research with the mRNA technology, right? So there's some promising uses, for instance, in cancer, maybe even for other uses, and we're still doing research on that because research asks questions. It be open-minded. Production contracts for the vaccine, the COVID vaccine, on the other hand, if you look at the numbers in the United States, I think it's like 20-30% of the population, despite universal recommendations for basically universal vaccination, only 20% of the population, 30% of the population have actually taken up the vaccine, the COVID mRNA vaccine. You're having it because public doesn't trust public health on this issue anymore. So why fund vast contracts for production of a vaccine that most people don't want to use? Instead, let's invest that money in vaccines where there is public trust. Let's invest that money in research on alternative platforms and technologies where they're very, very promising, and the public. We haven't squandered public trust with useless mandates or claims about efficacy that very obviously turn out not to be true 5 seconds after people say it.
Interesting. So that platform, the mRNA vaccine, is it a promising platform to build on, but it needs more research and rebuilding of, frankly, trust in that platform? Is that it?
Yeah, that's my view of it. I think it's a promising technology. I still think it needs a couple of iterations of of real ideas to improve it. But it is quite promising, and I don't want to say we're not going to look into it because it's something we should if in science we are willing to hold in our head this idea that it didn't work this time, but if we fix things and learn from the lessons, we can fix it and make it work next time. I mean, that's the spirit I'm trying to bring to this. That's
great. One of the things I think is pretty admirable, what you and Secretary Kennedy are working at is kind of a visionary renewal of the health of Americans. And I find this interesting. Can you tell us more about those initiatives? Because if you look at chronic healthcare issues, I think there's kind of shocking stats on the reality of, well, for example, the health of children is frankly not what it used to be. It's very concerning. Can you tell us more about those initiatives to deal with that?
the key, what you just asked is the heart of the MAHA movement, Make America Healthy Again movement. It's that we are facing a severe chronic disease crisis, enormous levels of diabetes, obesity, heart disease, cancer. You name the chronic condition, Americans have it. We're among the unhealthiest people on the planet. And we've gotten more and more unhealthy over time. And we have tremendous scientific advances, but they haven't translated over to actually addressing the key health needs, and especially of our children, as you say. And in many cases, we don't understand the cause. Like, why has autism risen to 1 in 31 kids having autism?
1 in 31.
About taking the resources we pour into science, pour into technology, and addressing those things that impact the livelihoods and well-beings of every American. And those advances then will help the whole world. Like if we are able to solve these problems, the lessons we learn will be applicable everywhere. Because it's not just the United States that faces this; it's just the United States faces it at a worse level than many other places.
Well said, Dr. Jay Bhattacharya. It's been a pleasure to catch up, my friend, and be able to talk not only about advancing public health, but also advancing the cause of science in our world. Thank you so much for joining us.
Thank you, David. So good to talk.
Thank you for watching Leaders on the Frontier. We're a nonpartisan think tank. We explore ideas, policy, and practical solutions that can make a difference in the lives of Canadians. We do not accept any government funding. We work for you. Thank you for supporting Frontier. Visit fcpp.org to give. While you're there, be sure to check out our latest articles and research. Without open discussion and debate, you're not thinking, nor are you free. Comment below. We'd love for you to join the conversation.